Hello, everybody, and thank you so much to those of you that are joining us live, and hello to anyone catching up on this recording. It's lovely to be together with the lovely modern midwife, Mary Louise. Good. Hi, Mary Louise.
Hello, how are you?
Yeah, I'm good, thank you. We were just chatting, weren't we, about your special news. I don't know if it's so nice to sort of share some things that have been happening to us personally that are coming up.
Yeah, exactly. So I got married 1 month ago, and it was everyone says, "Oh, it's the best day of your life." And I thought people were overhyping it, but actually, there is nothing like being a bride. And I wish I could do it all again, just being surrounded by people that you love. And it was a very intimate wedding, so we just had our immediate family and then three best friends each. So that was really, really special because, like I say, we were all so close, and me and my family are all best friends, so it was lovely for us to all just be together and celebrate love. It was, yeah, I just want to do it all again.
Oh, I love seeing the pictures of you, especially with your children, and now
Yeah.
you're sharing a name together. So that's what we were. It was nice to talk about that new name and your new name, Good with an E.
Good with an E, yeah, exactly. I was really pleased with that because my surname is Herworth and it's a bit of a Firth. So I'm really pleased to switch over to Good because that's quick, as simple and easy. So yeah, no, I'm over the moon. I couldn't be any happier, and we're in a little love bubble at the moment, despite not being so well over the weekend.
I know, I'm so sorry. I mean, talking today about nutrition and nutrients and well-being, and then to hear that you and your family have been poorly all over the weekend, I'm really sorry. I'm glad that we can be together, but I hope you've been able to get the rest you need as well, because that's always hard, isn't it, when we're parents?
When you're parents, it is really hard. And yeah, talking of that being a parent, so for you, October is birthday month, isn't it? For you and
Yeah.
your kids. So that, how do you do
Yeah.
it then? Whose birthday's first? How does it work?
Yeah, so it's my little lad Bill. He's turning 9 on the 14th of October, swiftly followed by Seamus, my eldest boy, who's out in America, and he's going to be turning 20.
Oh, wow.
So that feels really significant for us as a family.
Yeah.
Yeah, and lovely. And then my birthday follows, like they're my birthday presents. So each year they were born, it was so
Oh.
nice to be sat with them and having them there with me on my birthday. And mine's on the 18th.
Oh yeah. Oh yes, you're all really close then. Wow.
Yeah. So
Yeah.
we've just been thinking about how we might celebrate each other's birthdays over the next few weeks. So
Yeah.
special birthday month for us.
Yeah.
And we've really lucky to have the opportunity to kind of learn together, haven't we, over the time of the projects we've been looking at supporting, thinking about maternal and infant well-being as it relates to nutrition and family nutrition, and then thinking about micronutrients and the importance of iron specifically, and
Yeah.
feel really glad that we get a chance to think about this because it impacts so many of us as humans,
Mm.
but then very specifically women and childbearing women, and therefore our babies and children. So, this particular session that we've got an hour together to think
Mhm.
about, building on our last webinar with the Maternity and Midwifery Forum,
Yeah.
looking at nutrition more broadly. This is really going to focus on maternal and infant well-being and the importance of iron together.
Mhm.
So, both of us have worked together to develop the presentation and the content that we're going to share. And we're quite excited that we're going to be sharing some new information, new research insights, as well as reflecting and considering some of the impacts and consequences. So I'll be doing the first part of the presentation, then handing over to Marie Louise to take us through the second part. The agenda collectively, we're going to be looking at the importance of iron for pregnancy outcomes for the mum and the baby, and also then thinking about why iron can sometimes be overlooked and the impacts of that. I'm going to hand over to Marie Louise for the second part of the presentation, looking at the new data in this space and then the active iron impact.
Mhm.
So let's first just think about the importance of iron for pregnancy outcomes. We know, just as a recap for those of you watching, or maybe this is an introduction to you for the importance and role of iron in pregnancy, we know that certain nutrients are especially important in pregnancy. You can see here some of the food groups that can help us get access to iron in our diet and from our diet. So we know that folic acid, iron, calcium, vitamin D, omega-3, B vitamins and C vitamins are all really important. But also the micronutrient iron produces red blood cells to carry oxygen to both the mum and the baby, and so is a really critical and important part as we adapt and our physiology adapts to pregnancy. And what we know is that it's a vital micronutrient, essential for energy metabolism, oxygen transportation, as we've just said, blood cell formation and cell division, cognitive function, healthy immune system. And you can see that if we have a deficit of iron or a deficiency of iron, it can lead to mental fatigue, physical fatigue, and some of these other symptoms that you can see here on the diagram. And actually, when you look at these, we think, wow, there's a lot more impact on our bodies thinking about our well-being than you can imagine. And certainly what we discuss in our clinical practice, but also in our everyday lives. And actually, these are some of the things that when we're having a baby and when we're going through our childbearing journey, we may experience these things. I'm actually sat here at the moment with a mouth ulcer of my own. And I just think actually it starts to sharpen our attention to some of these symptoms that we can experience and signs of discomfort that we can experience in our lives as women and as childbearing people. It can be important to acknowledge some of these things and maybe start to look at, well, is this a micronutrient deficiency? Is it an iron deficiency? We also know that iron requirements for pregnant women and people increase 2 to 3-fold during pregnancy. And we know that 40% of those of us that are pregnant have low iron levels. So once a pregnant woman become iron deficient, diet alone is not enough. So we know that we want to do something about it, and we know that just eating iron-rich foods isn't going to really make a big difference. So it's still good practice to think about our diet and having an iron-rich diet, but we need to make sure that any iron deficiency is appropriately recognised and then treated. So beyond those discomforts and symptoms of iron deficiency, what are the wider health implications of low iron in pregnancy? Recognising that 40% of people that are pregnant are deficient and low in iron. When we look at the mum and maternal health risks, we can see picked up here again is tiredness, fatigue, and having this lack of energy. But we also know it's linked to increased risks of complication during pregnancy and childbirth. Due to the fact that iron's needed for the transportation of oxygen and the development of red blood cells, you can see why it's so critical that we address iron deficiency. It can lead to a depletion of iron stores and ferritin levels, impaired hemoglobin production. It can lead to anemia in pregnancy, increased susceptibility and severity of infections, poor cognition, concentration, and low productivity, affecting us in the workplace or with our family life, increased risk of maternal mortality and morbidity, increased risk of postpartum hemorrhage, which often is one of the primary concerns when we detect iron deficiency. It's always to think about preparing for birth and the postnatal period, but actually looking at these implications, we need to broaden our focus in our practice and work and think about the wider consequences and implications for maternal health. It also can lead to ongoing fatigue and palpitations and shortness of breath that we experience and can be a usual experience for women during their pregnancy as a cardiac volume and heart rate increases to respond to the growing needs of the fetus. but it also can be an attributable sign of iron deficiency. So again, making sure all the time in our work as clinicians, as midwives, and those supporting families and women that are pregnant, to always ask deeper questions and to make sure that we're following up with if any of these signs and symptoms are identified with appropriate blood tests and offering appropriate follow-up. We also know that low iron can also be associated with depression, low mood, and irritability. And that's something that Louise is going to pick up looking at some new evidence and research that helps us to understand that in more detail. So thinking about that's thinking about the woman, and obviously maternal well-being directly links to fetal and infant well-being. If we care well for childbearing women and people and get their health and well-being optimal, we can actually have an impact on infants and babies and fetuses. So here are some of the implications of low iron in pregnancy for infants and child health. Actually, there's a correlation between low iron in pregnancy with infant iron deficiency in the first 3 weeks of life. Sorry, first 3 months of life. And there's low birth weight. There's an association with low iron in pregnancy with low birth weight for babies. Preterm birth, small for gestational age, fetal growth restriction, increased risk of chronic disease, poor neurodevelopment, wasting and stunting that again is linked to that fetal growth restriction and small for gestational age and low birth weight. There's the micronutrient deficiencies, as we've said, this iron deficiency that follows from the pregnant person to the baby. And then the impact on school readiness, enrolment and learning performance because of those deficiencies and an increased risk of heart defects. Now, much of this data and information are associations, and we want to understand the impact of these greater. And it's great that there's emerging research that's helping us to unpack and understand this in more detail. This is critical because when we broaden out our understanding of the consequences and implications, we want to constantly turn back to the more serious impacts and consequences of poor health on the long-term impact on maternal mortality, not just morbidity. And we turn to the Embrace reporting in the UK to help us to understand what impacts our health and well-being has on maternal mortality. And what we can see from the 2025 Embrace report that's published annually, obviously these are looking at retrospective figures and data, and then reporting on it in a current year by year way. You can see here that there's a constellation of challenges and issues and a constellation of biases. So we can see that in the 2025 report, the leading cause of maternal deaths was blood clots, heart disease, COVID-19, mental health conditions, epilepsy and stroke. These are the 5 leading causes for those women who experience maternal death. You can see over on the left that looking at the data from those circumstances, there was a constellation of biases. And you can see 361 of the women that died had physical health problems. And we know that iron deficiency is a physical health problem that needs our attention and support. We also know that iron deficiency can increase the risk of blood clots. And we know from the new and emerging data that low iron can also have an impact on our mental health and well-being, as we've just mentioned. So whilst iron deficiency can actually be a contributing factor to all of the implications and leading causes of maternal deaths, blood clots and mental health conditions are 2 really important factors. We also know that obesity and nutrition or status of people also has an implication and association with an increased chance of maternal death. And that's something that we also want to pick up and recognise that maternal obesity can increase the chance of low iron and iron deficiency. So that's something that we want to also identify in this data for consideration. So, current guidelines for management of iron deficiency in pregnancy recommend 27 milligrams of iron daily, and the WHO recommend 30 to 60 milligrams. So, you can see the national and global recommendations there. NICE recommend taking a full blood count at booking and at 28 weeks, with serum ferritin checked in women who, although not anemic, are at an increased risk of deficiency. Women will only be advised to take iron if they're found to be anemic or at an increased risk of becoming anemic in pregnancy. For example, if having twins. You can see here that on the right, there is an outline of the definition of what we mean by iron deficiency anemia. And it's defined as a hemoglobin level of less than 110 grams per litre in the first trimester, and less than 105 grams per litre in the second and third, and less than 100 grams per litre in the postnatal period. So these are our current national guidelines informed by best evidence and to support best practice. So why is it that iron can often be overlooked in our work, but also in our lives? And this is something that we want everybody to be aware of, not just when you're in childbearing periods, but all women and all people. It's really good for us to have the awareness of the impact and consequences on our well-being and health. So we know that when it comes to iron in pregnancy, there are some challenges and constraints to addressing this deficit and to help prevent iron deficiency anemia emerging. We know there is underdiagnosis. There's also hesitance to intervene early on, an association with side effects. So thinking about treatment and adherence to treatment schedules when iron deficiency has been identified, we know that for some families and for some people that have been prescribed iron tablets and supplementation, that it's actually been hard for them to take and tolerate, leading to gastrointestinal symptoms and difficulties. We also know there can be confusing guidance or inconsistent guidance and lack of staffing or challenges with staffing that we've seen on the back of the COVID-19 pandemic. That also could lead to people missing guidance and information or missing treatment opportunities. And we know that wider than childbearing health, we know that women's health in general is under-researched and underfunded, research into women's health consequences. So actually, when we're looking at this, we need to think about well-being is key. We want any treatment plans and recommendations prioritize well-being, health, outcomes and experiences. We want any treatment that's offered to also care for people's well-being and not make people feel sick or have consequences that make it difficult to follow a treatment plan. So there is, by getting in early with really good diet and helping educate all people and families and all women throughout the childbearing continuum and childbearing years, it really can help us to avoid iron deficiency anemia. So if we can address low iron levels, it can help us to prevent anemia that can have the longer lasting impacts. So early intervention with supplementation can be supportive. We know that iron deficiency has enormous health implications for mum and baby, as we've just discussed. And we know that high dose oral treatment, if needed, does have increased side effects. Oral iron failure can lead to IV iron treatment. Preventative supplementation is key from preconception to the fourth trimester to help prevent iron deficiency anemia. So the aim here is healthier mums. If we can care for pregnant people, we know that it will lead to healthier babies, healthier pregnancies and births, and therefore better outcomes for all service users. So we wanted to take a moment to share with you some new data in this space. I'm going to hand over now to Louise, who's going to talk us through this.
Thank you so much, Anna. Can you hear me?
Yeah, we can hear
Oh, you
you.
got me back. Yeah, okay, great. Yeah, thank you so much. As we all know, staying up to date with new data is essential for us midwives and birth workers because, of course, information and research, it evolves really rapidly. So it is important for us to keep up to date with high quality research. However, it's particularly difficult because we're all so busy, and I get that. So we have collated some of the latest data that I'm actually really excited to share with you surrounding anemia in pregnancy and offering also some solutions as to, what we can do. And as Anna's just mentioned there, the preventative measures surrounding that, and also just information sharing. I think it's so important for us to keep talking about this to women so that they have the information that they need in order to make informed decisions about their health, because it takes a long time for guidance to change and policies to change. But what we can do is be proactive about sharing this data and sharing this information. So we have a study that was in 2024, and it was undertaken at the University College Cork in Ireland, and they found that 80% of pregnant women are iron deficient by their third trimester. So that number is huge, and that is even in a healthy population as well. So that's really important for us to remember, because traditionally a lot of research that's been undertaken on pregnant women surrounding anemia and globally has been done in deprived areas. But this is really important for us to understand that this is a healthy population. So they recommended really that there was a need for routine iron screening and an improvement around there. And they recognized the complications that are associated with iron deficiency anemia. And they looked at how to really reduce that risk. And in conclusion, this is a quote from them, they've concluded that pregnancy places a remarkable strain on maternal iron status, even in high resource countries. Generally, iron supplementation should be considered. Women should be screened early in pregnancy for iron status with a suggested target ferritin of more than 60. So that is actually double. Their recommendation is double what we would look to diagnose as low ferritin at 30. So, it's important for us to bear this in mind, because if we are meeting mums that are just on the threshold, what do we do with that information? How do we action it? How do we support them to have a healthier pregnancy, knowing about this data, for example? Thank you, Anna. Sorry, Anna's got the slides. So I was really excited to see this PANDA study that is currently underway, and it's being led by the NHS Blood and Transplant at the University of Oxford. So I was really excited that, as I say, the NHS are getting involved. This trial investigates if taking iron supplementation preventatively before mums have developed anemia, could that provide benefits to both mum and baby and reduce the risk of stillbirth, preterm birth, postnatal depression, which we're going to talk about in a minute, hemorrhage after birth, and the need for blood transfusions? So the PANDA trial will identify if these problems can be safely addressed using supplements of oral iron, as we do not know this. And I mean, what a shocker that we don't know this, because some of the associations between iron deficiency anemia and pregnancy, as Anna's run through for both mum and baby, can really be quite scary and quite severe. So the fact that in 2025 we're only just investigating this in the NHS does raise some questions for me. However, I am pleased to see the action, and I am pleased to see the movement towards looking at preventative measures. And then we have some brand new data around in 2025. So prior to that, there was a study or some research that looked at the impact of iron deficiency anemia on neonates and the impact on their cognitive development. And they concluded that iron is crucial for neonatal brain development. I think, we all knew that already, but it's good to see it in research, cognitive, motor function, and behavior. And there was another, as I mentioned, another study very recently that I actually wrote an article on myself. And this was a huge sample size of 16,000 mums. And they found that if the mother was anemic in the first 100 days of pregnancy, the likelihood of having a child with congenital heart disease was 47% higher than the usual risk at 1 in 100. And I think that is significant, of course, for a number of reasons, but not only are we looking at cardiac health for mothers now, it's a consideration for their babies as well. So this goes all the way through, from pregnancy all the way through back to the baby, and looking at how we can prevent these cardiac issues. And we know that cardiac problems, heart disease, is massively on the increase in the UK and globally. So, looking at what we can do as preventative measures and where health starts, and health starts in the womb. So this was also particularly interesting because this was after they found these results of the 47% increase after adjusting the factors that can raise the risk of congenital heart disease, such as the mother's age, because often, other, comorbidities, etc., would be associated with that. So that was really interesting, actually, to see that they did adjust based on that. So as a result, now researchers will investigate whether taking iron supplements before and during pregnancy can help to reduce heart defects at birth. And this is something I've been talking about for a long time. I've written about it in both of my books, the association between postnatal depression and anemia. And there is a huge growing body of evidence that links low iron levels during pregnancy and postnatally with postnatal depression. And we know how important this is, again, because the prevalence of mental health or poor mental health postnatally is increasing. And as we see on the latest Embrace report, it's still there. Maternal health, mental health is so important because it literally will save women's lives if we do more to protect women postnatally and antenatally. So there are several studies. I'm just going to very briefly run you through some of the biggest and most impactful. So as a systemic review and meta-analysis in 2019, and that found that postnatal anemia nearly doubles the risk of postnatal depression. There was another study in 2020, another meta-analysis, and this included 32 million women, and it found that anemia was linked with a 1.5-fold higher increase of maternal depression during both pregnancy and postpartum. And then when we look back at the other data that demonstrates 80% of women have anemia in the third trimester, for example, and then you're looking at, there's a 1.5-fold increase, which is so statistically significant. I just think it's really important, as I said at the beginning, that even if we can't change policies, even if we can't change the parameters under which we work at identifying women that have lower ferritin, it's really important for us to continue to think outside the box and continue to explain to mums, okay, you haven't met the threshold perhaps for having low ferritin, but you're on the way there. And is there something that we can do to support you? Discuss with them their diet and the importance of their diet as well. Discuss with them the options that are available to them with supplementation on the market. Another study, sorry, there's just two more around postnatal depression. A prospective cohort study in Japan in 2019 that found, again, postnatal anemia increased the risk of postnatal depression by 63%. And yet another study in 2018 of 17 studies, systemic review of 17 studies, reported that 8 out of the 10 studies showed a high risk of postnatal anemia and postnatal depression increase the risk in 4 out of 5 studies. So again, I mean, looking back at all of this data, some of this was published in 2018, 2019, 2020, and here we are in 2025, and we're still not talking about this enough. So I think this is a real key takeaway in particular around the link between postnatal depression and anemia. So moving on to talk a bit about potential solutions. I've worked with Active Iron now for 5 years, and in a professional capacity of, delivering these kinds of webinars, and we engage in a range of activities. I'll mention a little bit in a little while about their healthcare hub, but I've contributed to their healthcare hub, and we've been working together for some time now. And on a personal level, I've taken Activine throughout both of my pregnancies and the postnatal period. And any kind of brands that I work with, I always ensure that I do my own research. And part of that research is often using the product or taking the product. And of course, I've only got positive things to say. I didn't have any symptoms at all. I'm vegetarian. I did have a previous history of low iron levels, and fortunately, my iron levels throughout both of my pregnancies were fantastic. And postnatally, I made a very quick recovery, I would say, overall. So, and I do think that that was a contributing factor. Of course, there were lots of other things that I was doing in my pregnancy to, to look after me and my baby, and postnatally, and, working out, eating well, doing all of the other things that we recommend for our mums to do. I was doing all of those things myself. But I do think that taking Activine did have a positive impact on me personally as well. So Activine is unique because it is a groundbreaking patented formula. So there isn't any other formula like this on the market. So it has the ferrous sulfate that's wrapped in a protein, a carrier of a short chain of fatty acids. And what that does, in summary, is it makes sure that the active site of absorption, that is where Activine lands. And that can reduce symptoms so that we're really familiar with, the nausea, the constipation. But that is why, because they have a groundbreaking formula, as I say, that isn't available anywhere else, and it actively targets that site of absorption, which is crucial. And we'll talk about the data just now. So Activine is clinically proven. That's another reason that I love working with the brand as well, because they pay particular interest in creating their own data and also looking at all of the data that is available to us to ensure that they are keeping up to date and ensure that all of their marketing and all of their communications is factually and statistically correct. So it is clinically proven. Most oral iron, as we know, is poorly absorbed, and that poor absorption causes inflammation and oxidation in the gut, and that then is what causes those side effects, such as most commonly nausea, constipation. There's a whole range and list of other symptoms that women report, or that people report, but those are the two that are most common. And of course, that's particularly difficult for anyone. But when you're pregnant and you've already been through, more than likely, some form of nausea and constipation, as we know, is very common during pregnancy due to progesterone and everything slowing down in the digestive system. So the last thing that pregnant women are going to want to do is take a supplement that causes those kinds of symptoms. So it's, as mentioned, it's clinically proven. So if we're looking at tolerability and compliance, so there is 6 times less gut irritation with Activine. And as I say, that is due to the site of absorption and the reduction there in the oxidation in the stomach that causes those symptoms. And it's therefore no surprise that when studied, there was a 4 times better compliance with active iron in comparison to the previous oral iron that the participants were taking. Also, extremely important, active iron showed a 94% increase in iron stores. So the product really works, and we've got the data to prove it. And that also resulted, again, no surprise, significant improvements in energy levels too. And this study was undertaken around COVID, when I think everyone was feeling pretty exhausted, perhaps a bit anxious as well. But yet the participants in this study reported a steady increase in energy over time. And I think, when we're looking at holistic health, we're not just looking at the problems that women are facing in pregnancy. We should also be looking at the solutions and how that is impacting their lives as well. Because, this is we're looking at a whole picture of overall health, and going back to mental health as well. It's particularly different. There's difficult, but there's a lot of pressure on the modern mum and the modern woman today, to do it all, to be it all, to work, mum, all of these things. And I think, it might seem like a insignificant finding. Oh, your energy levels were increased. But actually, I think it's really important for us to look at this stuff and look at the quality of life and the impact that that has, because we all know how rubbish it is to feel exhausted. So I think it's really important to look at lifestyle and how such a simple solution can have such a profound impact on women's lives. So just a quick summary there. So the bioavailability with active iron specifically, 2 times better absorption, it's highly absorbed. Compliance, 4 times better compliance, they're more likely to continue taking the product. Tolerability, 6 times less gut irritation, and that's because, as we've mentioned, the non-constipating formula that has been patented and is unique. Efficacy, 94% increase in iron levels in 6 weeks, which I think, again, that's a brilliant turnaround time-wise. Energy levels, increased energy, fights tiredness and fatigue. So ongoing research, as I mentioned before, active iron are particularly forthcoming when it comes to research. So we're going to have a quick look now at some of the research projects that they are involved with. So we have Ulster University. So Active Iron is partnering with Ulster University on a clinical study in pregnant women. As Anna mentioned, research in general for women is massively underfunded. And I think, I'm really proud to work with a company that actually have such an interest in the impact of their product. The aim is to assess the impact of supplementation with active iron on iron status in pregnant women with the aim of improving health in pregnant women and their infants. And again, hopefully this will go into the body of research that I've, just run through with you. And active iron will then be able to sit alongside all of this research that we've got up and coming to build this body of evidence that demonstrates the importance of iron during pregnancy. And over 300 mums will be involved in that study, which is brilliant as well. Another up and coming clinical study amongst athletes. Again, this is female focused, which is brilliant. And the aim is to explore the prevalence of low iron in high performing athletes and assess the effectiveness of active iron in improving iron status and enhancing exercise performance. And interestingly, iron is, of course, crucial for athlete health and performance, yet low iron is common in active populations. And I think, again, going back to women are far more likely to have anemia due to having periods and bleeding every month. It is really important for us to also consider that ourselves outside of pregnancy as women and our overall health, as Anna mentioned before, and have that consideration. Am I getting enough iron? Because it is ever so important and it impacts so much of our overall health and well-being. Active iron have a range for women's health. As mentioned, it's clinically proven, actively absorbed. And they have their advanced product. That's the product actually that I take in general. They also have a pregnancy product, and they have their active folic that has the biologically most available form there. And lastly, I'll hand over to you, Anna, but there's a brilliant course on the All4 Maternity Hub. There's loads, there's so much. When I went on, I hadn't been on your platform for a while, Anna. And when I went on, I was like, oh, wow, like this is incredible. There's so much information on there and so much support. And it's also really lovely to be part of a community. I think, as I mentioned, midwifery it's difficult, it's busy. But yeah, it's really nice to feel part of a community, as well as supporting best practice, keeping up to date with your CPD. There's a brilliant course that is available on All4 Maternity, and you can scan the QR code just there and it will take you straight through.
Oh, thanks, Louise. I'm glad that you've been able to have a look around. I think it's so important that we are always developing and publishing resources that support busy clinicians, students and colleagues working across maternity and perinatal care with a diverse range of content to make sure that health and care across the childbearing, birth and postnatal continuum, we can help to ensure safety, quality care and optimal outcomes and experiences. So yeah, we really want to make sure that we're there for families. This course will give a deeper dive into some of the physiology that underpins the importance of iron across the childbearing continuum, which I think can be really important for us to understand why it is that there's all the health outcomes that we've talked about today and health implications for the woman and baby, why it's really critical that we understand physiology so that we can understand why that leads to a deficit, why we should take it really seriously when we recognise and offer treatments, as well as offering blood tests and supporting families to access care. Because what we know from the Embrace report is that, the fragmented care that isn't joined up, can really be one of the contributing factors to how people slip through the net and
Mm.
have poorer health outcomes and experiences. And we know that because the report really sharpens our focus on addressing health inequalities, the disparities and injustice that we're continuing to see across services, it's really critical that we work to address those from minoritized, marginalized communities, and in particular those with multiple confounding and complex lives and confounding complex social and health factors. And that's sort of what we really want to make sure everybody has, that evidence informed information. And this is a course that will help to add to what we've shared today. Also, Mary Louise, it'd be great to hear more about the health hub that you've been working on alongside Active Iron, where people can go, especially families, to get more information, but as well now, healthcare professional hub.
Yeah, exactly. So it is jam-packed with information, with, latest data, research, and some really interesting articles. I haven't written all of them, I've written a couple. But Dr. Stephanie, who you see just there, who's also one of my friends, is part of the hub as well. And yeah, as I say, there's a range of information that you can go and access in your own time. And also, I believe on there as well, you can get a free sample of Active Iron if you would like to try it yourself if you're a healthcare professional. Um, so yeah, go and check it out and have a little look around. And the articles aren't particularly long; they're fairly short reads as well. As I mentioned before, I know we're all super busy, so most of the articles you could read them in 5 to 7 minutes, for example.
And it's good that we've had a chance to sort of have a dive into some of the latest evidence today, but I imagine the links to those papers that we've discussed today will be accessible in the Health Professionals Hub and in the course that we've shared. So updating information and knowledge that we can learn from is fantastic, but we wanted today to give you a bit of an insight and summary of that. So we hope it's been informative. So thanks so much to everybody for listening to our presentation. Obviously, it's scratching the surface of a really important area of clinical practice and safety in maternity and perinatal care. We invite people that are watching live to share any questions that they might have. I know um, from Paul that's been monitoring for questions, there isn't anything that's emerged just as yet. But I suppose it would be good to think about reflecting on our own practice and thinking about how we can strengthen quality, safe, evidence-informed care for midwives working and maternity professionals working in practice currently. Is there anything that you think, you work in clinically at the moment, Mary Louise? I know we've chatted a bit about, what's emerging, what seems to be issues that are arising in clinical practice. Is there anything that you've noticed or want to share about that kind of experience?
Yeah, so most recently, just last week, so I hadn't practiced clinically for a little while after I had my little Frank. He had many issues, bless him, when he was born and was a very unhappy baby. So that meant that I didn't practice clinically for a while. And I'm not really sure what I expected because the mainstream media and the reporting around maternity services, there's some really damning reports that came out, and there's been some quite unkind headlines about midwives and failings and things like that. So yeah, when I went back into practice, I was sort of a bit nervous, to be honest with you, about that and how I was going to feel, what I was going to find. In my own practice and those, the challenges of not practicing for a while and going into a new environment. But anyway, what I noticed actually was really reassuring. I noticed some real positive shifts and changes. And I hadn't worked the unit that I'm working at. I have never worked there before, so that's why I think I was a bit more nervous because I was going somewhere new. But But actually, the midwives and the doctors were very woman-centered, very respectful. And there was one doctor that I worked with in particular throughout the day, who just kept saying to women, this is your choice. I'm sharing this information, and this is your choice. It's up to you what you do. And it was really great to hear him keep reiterating that to various different women that we saw that day. And I think that it was really, yeah, it was really lovely to see that improvement, because I think historically there has been a bit of push-pull between healthcare providers, perhaps feeling more responsible to make the decision for the woman, or push women into a decision that didn't necessarily feel right for them. But
Mm,
I think we're now moving more towards informed decision making and accepting that actually it's the mother who takes that responsibility for the decision. And if it isn't the right decision, or there is an adverse outcome, that was her decision that she is free to make, and she has
mm,
rights around her decision making. So
mm,
actually to see that in practice was really reassuring. And it wasn't just that one doctor. I've worked with a few different doctors now and a few different midwives, and they have all been the same. So yeah, I think it really restored my what I had always sort of thought about midwives and how we work and how caring we are. And I think it is very difficult climate to work in at the moment. We are massively understaffed. There's a national and global shortage of midwives. But it was really lovely, as I say, to see that progress that we continue to make, and the feedback, obviously, that the unit has been getting. They must have really taken that on board, because this was what a repetition of what I was seeing, is this emphasis on you are the decision maker and empowering women to make those decisions for themselves. So I think that was a really positive takeaway for me personally.
that's brilliant. And I think, that sort of strengthening of evidence-informed practice and supporting staff to feel up to date and skilled, knowledgeable, and responsive to the families that they're caring for with the personalised care approach is
Yeah.
amazing. And I think I remember we chatted a little bit about you working in the service that helps women that come in with concerns or challenges, and you'd noticed that there was some women coming in for various treatments and how responsive the service is to that. So it was good to
Yeah.
hear that. And actually, we've got a question now from Jess, who's joined us, just saying about iron supplementation. How does iron supplementation sit alongside other supplements if women are taking complex multivitamins, for example, e.g., pregnant care? I imagine there may be questions from women around if they can double up on certain vitamins and minerals. So, what might the advice be?
Yeah, exactly. It's a great question, and it's a question that mums often ask me as well. So, Activine do have a new and improved pregnancy product. It's got a triple layer, so it has a multi-release vitamin to maximize absorption. Because sometimes what happens is if we chuck a load of vitamins in one place, there's some competing around absorption. So, there's a special time release formula that Activine have. So in terms of to be quite upfront, you can make a quick switch from pregnant care to Activine, and you don't need to double up on anything at all. Um, a lot of pregnancy supplements have particularly low iron. If you have a look at exactly the amount of iron that is in those supplements, it is very low. So it's more than likely that you would be able to double up on that safely, because some of them have only got, for example, 7 milligrams of iron in them anyway.
And I think as well, like you mentioned about the absorption, and there's ways
Mm.
that we can support our body to absorb the iron that's available both in our diet, but also in any supplementation that we take or choices we make around supplementation.
Yeah, yeah. And to be clear as well, it's very difficult, I know, for pregnant women. And having been pregnant myself, I'm veggie, as I said, and I didn't even want to look at a bit of spinach or any beans or lentils. It was just carbs for me. That's all I could stomach for 3 months. So I do get it. However, it's also really important that we are upfront about how important diet is and how important it is to get our nutrition from our diet as well. And don't get me wrong, of course we're here, and discussing nutrition in general and supplementation. But yes, it is really important to inform mums as well about about nutrition and about what they're eating and not just supplementation.
And that it's part of that wider piece around our microbiome and feeding our good bacteria and taking
Exactly.
great care of our gut as a way for the gut-brain axis and thinking about our general well-being, but also thinking about the gut as the source of, our whole strength and well-being, beyond looking at iron specifically, but actually more broadly at our well-being. So I think that's really critical. We've got another
Absolutely.
question here about current guidance on iron levels or cut-offs. Can
Mm,
sometimes seem confusing when you think
yeah.
about clinical practice, but also for families as we're aiming to inform them, them, like you said, with your experience of returning to practice recently after having Frank. It's nice to see that you're working with really competent and proficient staff that are working alongside women to update them and inform them. But obviously, if we have confusing or guidelines that can seem confusing to us as clinicians, that can have a knock-on effect being confusing for families. So
Mm,
it's early intervention, a best way to avoid anemia and iron and IV iron. So just thinking about that trajectory,
mm.
I know it's something that we mentioned in the presentation, but is that something that could be helpful?
Yeah, absolutely. And I think it's early identification. So it's having conversations with mums about their lifestyle. Did you have heavy periods before? Were you tired before your pregnancy? So it's about, that individualized, personalized care. Um, and the data that we've shared today as well, looking at whether or not iron taken preventatively will reduce preterm birth, for example. We'll be able to have that data fairly shortly to be able to support the information and advice that we're sharing in practice. So it may well be that guidelines change in the near future to mirror what we've been saying for a while about folic acid, vitamin D, for example. And maybe that is as well what we will discuss with mums is, to start taking iron prior or in early pregnancy. Who knows? I think that is likely, but this moment in time to inform your practice, what I would really say is really look at individualized care and having these conversations with women, as I say, about their lifestyle, about their diet, about any symptoms that they're having, and then looking at their bloods in combination with all of that, because of course it's not just about a blood test result. We work holistically as midwives, and I think it's really important that we continue to kind of push that strength that we have as midwives and to have these conversations with women and to dig a little bit deeper. I've always thought that that's a bit of a superpower for midwives is those relationships that we build with women and get to know them and their background so well if we have the time to do it. So keep your eye on the data and don't just look at the blood result in summary.
Yeah, I think it's really important to those early conversations that we have. And obviously it would also be great if we could work with people that offer preconceptual care, like working closely with GPs and other professionals that might come across the family or person before they find out they're pregnant, that can start to have this conversation with all of us at childbearing years. Optimizing our pre-pregnancy health and well-being has a massive impact on those early months and
Mhm.
throughout the duration. But you also said something really important about your personal experience. I think it's really relevant when we're personalizing conversations and care, that we do want to ask questions about, how people do feel pregnancy, experience pregnancy sickness through to hyperemesis gravidarum, a much more serious complication of pregnancy that can make people really unwell. And I know there's some brilliant work going on campaigning to make a difference in that space to address the health and wellbeing needs. But if women aren't able to tolerate food like you found and certain food groups, then supplementation can be uh,
Mm.
an option, and having that conversation and helping people feel informed with what's available, along with all the other things that we share and inform families about. And it's about that informed, giving information for informed decision making, isn't it?
Mhm. That's it, exactly.
There's another question that actually just popped through, from Philomena Fadden. So I've noticed a lot of women who are anemic, particularly in the last trimester, are also vitamin B12 deficient after
Yeah.
further testing as well.
Yes. Very common, that link. Yeah.
Yeah, and I think that because again, those our B12 deficiency also can be linked to our diet.
Yeah.
and food groups that we're eating.
Hmm.
Obviously, all nutrients are. So, any kind of work that we do to address iron deficiency is likely to also support us to become um, supported in other areas in terms of the diet, and if we make moves to strengthen and improve our diet. And I think that's why it's so important that you said it's not just about taking supplementations, it's supplementation with move towards healthy nutrition and nutritious and balanced diet. I
Hmm.
think anyone that wants to dive into the impact of maternal and perinatal nutrition more closely can have a look back through our previous
Yeah.
webinar on the, it's all freely available through the Maternity and Midwifery Forum, and also the course that we've shared. And we're also going to be running a seminar, a professional seminar where we invite experts to come and talk about the importance of nutrition, and maternal and perinatal nutrition for the whole family, at the end of the month. So we look forward to welcoming people to that as well. So I don't know, in terms of, if we're concerned about being deficient in any way, then we also can, it can prompt further investigations
Yeah.
through our GP, through our
Agree.
obstetricians, through our medical colleagues. That you talked about working collaboratively
Mm.
in modern maternity and midwifery services and perinatal services. That strengthening of collaborative work, working alongside all colleagues to optimize health and well-being is so critical for both the mother and the fetus and the infant and family. And
Mm.
it's really lovely to hear that that's something that you've experienced, and that's something that we obviously want to do. And it's great to see that the hub is bringing together professional information for all practitioners working to support families.
Yeah,
Um,
exactly.
it's good, isn't it?
Yeah, absolutely. And on another personal note, I've just supported my sister, who I've got permission to share this information. I've got permission from her. She has had a really, really tough time with anemia and being dismissed, unfortunately, by her GP, which I think can be fairly common. And when women go to the GP with certain symptoms. But fortunately, so I've supported her through it, as I say, and we finally got her ferritin checked. They were very reluctant to check her ferritin for some reason, and it was through the floor. But and she couldn't take ferrous sulfate, so she's been taking active iron for a while now, and her iron levels and her ferritin have both come up. Her symptoms have improved massively, and she's actually able. She's got her own business, and it was impacting her work and her whole life. And she's actually now able to work longer hours, and therefore she's doing better financially, and so she's less stressed. And it's had this whole kind of like cascade of positive impact on her life. And I just think from that, luckily, I was there to support her and help advocate for her and really push because she was saying to me, "Well, I don't really understand what is a ferritin," and we talked about it all. So I think it is, although what I've experienced in my recent practice in midwifery has been very positive, I think that there are still issues that remain for women when they do report certain concerns, certain symptoms. So I think, yeah, it's just important as well to continue to advocate for yourself, and just know that if, what I always say to mums, if you feel something's not right, it's because something's not right, and you need to listen to that, and other people need to listen to that too.
Yeah, and that, I think, the message for any clinicians and health professional colleagues that are on the call, including midwives, is that capacity to, and taking the time to listen
Yeah.
and be mindful of addressing inequalities where we can make sure that the services are fit to meet the needs of the communities that we serve, that we're doing the work to reach out to people that might experience health inequalities or minoritisation in the structures and ways that our services are designed, but also unpacking our own bias and thinking
Yeah.
about making sure that we're communicating with everybody, using the right communication, support vehicles like translation services and support services that can help us to make sure that everybody gets this message, not
Mm.
just a few. Um,
Yes.
I hope that everybody coming to the end of the webinar now, that people that have joined, that it's giving you some updates and information. It's certainly in preparing it, updated us with our practice and helped us to feel informed with the latest research and evidence, which is always good to pull that information together for a presentation. And we hope that it really encourages any health professional that's listening to make sure that they prioritise the early conversations around nutrition, diet, lifestyle, and then also follow up on all the recommendations and guidelines from NICE guidance and WHO guidance to ensure their local guidelines are up to date, offering the right support for families.
Yeah, exactly. Thank you so much, Anna. So well said, as always. I'm always in awe of you when we do anything. You're just so articulate and so
Oh,
knowledgeable.
I think that with you, and I feel proud that we can offer support to all of our busy clinical colleagues that are working hard to provide safe, quality care for all. And we know that can always improve and strengthen the work
Yeah.
that we do, and being part of that support to do that. And we can all play our part together, can't we, to do that? So thank you for the opportunity, Mary Louise, and to the Midwifery and Maternity and Midwifery Forum for hosting us to share this information. Anybody watching, please do share the resources that we've discussed and a link to the resources if you're watching this on catch up. Share it with colleagues and your local communities so that you can feel up to date and help other people to be up to date with the latest information.
Yeah,
Thank you,
exactly.
everybody. Have a lovely afternoon.
Thank you.
Bye.
Bye.